Hello everyone, we are Group 8 and we will be presenting about diabetes, a condition that affects millions of people worldwide. Before we dive into our topic, here is a quick introduction to our group members. Now, Silver will start the presentation.
Diabetes is a long-term health problem. Your blood sugar stays too high. There are two main types. Type 1 diabetes often starts when you're a kid. Your immune system messes up the cells in your pancreas that make insulin. So, you have to get insulin shots to stay healthy. Type 2 diabetes is more common in grown-ups. It happens when your body's cells don't use insulin right, that's called insulin resistance, or your body doesn't make enough insulin. Things like being overweight, not moving enough, or family history can cause it. Then the last type is gestational diabetes. It occurs during pregnancy due to hormones interfering with insulin. It usually goes away after the baby is born, but it increases the risk of developing diabetes later in life. Now I will pass it to Amina.
Now we'll be talking about which medicine is commonly used by patients with type 2 diabetes. Doctors usually recommend metformin, which is an oral medication used to lower blood sugar levels. There are several reasons for people to take this medicine. Some of them are it improves insulin sensitivity, where the body uses it more effectively and reduces the insulin resistance. It reduces the liver glucose production, where it slows down the glucose production by lowering the blood sugar levels. It does not cause weight gain, rather causes a slight of weight loss, which is really helpful for people in this case because majority of them are overweight or obese. It has low risk of hypoglycemia even when they're taking alone and is very safer with patients. It is very affordable and has been used for more than 60 years and has strong evidence of benefit. And lastly, it has possible heart benefits which reduces the risk of many heart diseases. Next, Maicha is going to take it from here.
Pharmacokinetics, which refers what the body does to the drug, as in metformin. At first, metformin is absorbed primarily from the small intestine with an oral bioavailability of approximately 50 to 60% under fasting conditions. As metformin is fat soluble and cationic, its absorption involves transporter proteins, such as organic cation transporters and plasma membrane monoamine transporters, which facilitates the uptake across the intestinal epithelium. Next, distribution. Metformin has a large apparent volume of distribution, from 300 to 1000 liter, indicating extensive distribution into tissues. It exhibits negligible plasma protein binding, which contributes to its wide tissue distribution. It accumulates notably in red blood cells, where it has a longer elimination half-life compared to plasma. Liver concentrations may be 2 to 3 times higher than plasma levels due to portal vein absorption and first pass hepatic intake. Moving on, the third process is metabolism. Interestingly, metformin is not metabolized in the body. It remains unchanged, which simplifies its pharmacokinetic profile and reduces the risk of metabolic drug interactions. Next, the last process is excretion, where drug is primarily eliminated unchanged through the kidneys via tubular secretion. The plasma elimination half-life ranges from approximately 4 to 8.7 hours, with most of the drug excreted in the urine within the initial hours after dosing. Renal function is critical for metformin clearance, and impaired kidney function can lead to drug accumulation and increased risk of lactic acidosis.
Pharmacodynamics of metformin is divided into three sectors: efficacy, potency, and affinity. Metformin is a highly effective drug for type 2 diabetes, which lowers the liver glucose production and improves insulin sensitivity. Its potency is moderate to low, meaning higher doses typically are needed compared to some other medications. Unlike traditional drugs, metformin doesn't act through a receptor ligand interactions, rather, it enters the cells via OCT1 transporters and activates AMPK, which regulates the blood sugar and fat metabolism. Its effectiveness depends on cellular uptake rather than receptor affinity. Now, Janko is going to take it from here.
So the side effect of metformin can occur in two sections. The first is require medical attention, such like abdominal or stomach discomfort, and fast or shallow breathing, or fever or chills, or low back or side pain and sleepiness. The second case is self-disappearing, such like acid or sore stomach, vomiting, weight loss, or metallic taste in the mouth, heartburn, and indigestion, so I will pass it to Zamba.
When metformin isn't enough, other options can help manage blood sugar. Firstly, we have the GLP-1 receptor agonist, which boost insulin, reduce appetite, and glucagon, support heart and kidney health. Side effects include nausea and vomiting. Secondly, we have the SGLT2 inhibitors, which help excrete glucose in urine, lower blood pressure, and aid heart health. Thirdly, we have the sulfonylureas, which increase insulin but may cause low blood sugar. Insulin therapy is used when oral meds aren't effective. The combination therapy is the combination between the metformin and the PPAR agonist, for example, pioglitazone, improve glucose and lipid levels. The TZDs enhance insulin sensitivity, may cause weight gain and fluid retention. Lastly, we have the alpha glucosidase inhibitors, which slows the carb digestion to reduce post meal sugar spikes. Several traditional practices can support blood sugar control. For example, herbs like gymnema, bitter gourd, neem, and turmeric may help increase insulin levels and reduce carbohydrate absorption. Ayurvedic detox, also known as panchkarma, especially virechan and basti, is believed to support gut and microbiome balance. Lastly, we have the yoga and breathing exercise, which can improve insulin sensitivity and overall metabolic health.
Metformin is not just used for type 2 diabetes. It also plays a role in preventing diabetes in high risk individuals, managing gestational diabetes safely during pregnancy, and treating PCOS by improving menstrual cycles and fertility. Additionally, it is used off label for weight management and even as an add on in type 1 diabetes to reduce insulin needs and support heart health. Moving on, metformin also shows promise in lowering heart disease and cancer risks, protecting the brain, slowing aging, and is being studied for conditions like Alzheimer's, fatty liver, COVID 19, and even kidney production.
To sum up, metformin remains the go to choice for type 2 diabetes. It's effective, safe, and affordable. Beyond blood sugar control, it offers broader health benefits, and when combined with lifestyle changes or natural therapies like yoga or Ayurveda, the overall impact can be even greater. It's a simple yet powerful tool in long term health management.